It's really a great pleasure and honor to introduce you all to someone whom I knew during my specialty days when I was in India doing my initial cardiology training. And I had come across one of our colleagues who was doing her internal medicine, DNB, and we used to interact several times and all. But we were always connected through Facebook and all. I used to scroll a lot of times about the different updates and all. I was pleasantly surprised several months ago when I saw she was posting regularly about some really nice things, like something about related to spirituality or the inner health, and this is something which I really felt touched about it. And that was one of the reasons I couldn't resist myself to literally spam her inbox and to be able to contact her so that we could gain from her wisdom, for which she has really put a lot of effort, of course, to gain that knowledge. I think all of us, being healthcare professionals, we all tend to understand that better. So I would hand over to Dr. Poonam Maurya to give a little bit of background about her academic background and all, and to give us more insights about what her YouTube channel is about and what she has been posting recently quite a lot. Thank you.
Thank you, Naren. It is such a pleasure that I'm getting introduced by you, and it was a long-term, nice friendship and a very nice time spent at our initial. I think the first hospital, Narayana Vidyalaya, where we were together for our courses. So it was nice. Thank you for the introduction. So I started my medical career. If you see, I hail from Mumbai, Bombay in India, and my MBBS I did from Grant Medical College, Mumbai, and thereafter I came from Mumbai to Bangalore after marriage when I got married. And after marriage, there was a gap. I had my first child. When my child was around 1 year, then I got into my internal medicine, general medicine. I did DNB general medicine from Narayan Vidyalaya, Bangalore. And then thereafter, at the end of the general medicine, I had my second child. So I was not sure what would I do and all. So I spent some time in nephrology fellowship. I wasn't clear what I really wanted to do. A lot of confusions we all go through in life, and so was I. And then nephrology I wanted to pursue as a main career, but I could not get the nephrology as a DNB specialty. So then again, there was a lot of confusion. And finally, I took up medical oncology, thinking that I have never been exposed to medical oncology. Let me take it up. That was the thing. So I took up PNB medical oncology, and then I finished. So now I have two kids, family, and I'm a practicing medical oncologist at Apollo Hospitals, Apollo Group of Hospitals, Bangalore. I covered 3 to 4 hospitals of Apollo, as well as I'm also attached as a visiting consultant at KIMS Hospital, Bangalore, which is a medical college and hospital. So this is about my academic background. And to start with, little bit I'll tell you that. About my channel. Before I start my channel, when we thought that we will be talking about my channel today, I was thinking from where to start and what to start and what to write. I haven't written anything, but I think this channel, inner MBBS channel of mine, YouTube channel, the roots I think go back to my childhood itself. If I look, because I came from a not very wealthy family, but yeah, middle class from Bombay, and from the row houses in Mumbai, the Chawls. And my father had a dream that my daughter would become a doctor and all. And looking up to his dreams, my only dream was to fulfill his dream, my parents' dream. So that was the only dream. And I used to do my best. I used to study a lot of hard work put in, and whatever obstacles came, challenges came, financial or social or whatever, I was like, no, I have to do this. That's it. The never quitter, go getter, that kind of attitude I had from the childhood, and my ambition, like I wanted to do this. That's it. Very focused right from childhood. And I don't know from where this came, but this is how I was, and that led me to my career. In fact, I lost my father as soon as I got admission in
Bless you.
MBBS. I lost him in a road accident, just within 3 months of admission in MBBS, and that was the life-changing event in my life, wherein the most important person in my life, father, usually daughters are so much attached to father, I lost him. And even then, I was like, because the eldest in the family, I never thought the only mission again was to complete my MBBS because that was his dream, and I'm sure even whether he was there in the world or not there in the world, the only ambition in my life was to complete MBBS. So I just pursued my dreams. In fact, my relatives and all were very surprised because how would I complete without father, no financial support, and then how would I really complete my journey of MBBS and academics? So it was tough. It was tough if I remember all that. But there were a lot of good opportunities. I got a lot of scholarships. I got a lot of support from books and even finances. And even this story, I used to tell earlier in a very different way that, oh, I suffered a lot and I had this and that. Now I say the universe really threw a lot of support and opportunities to me, and people were there around to help me. And in spite of father being not seen in the world, but I think I got immense support. And once I got married, again, it was an arranged marriage, and I'm so blessed and so lucky to being married to such a wonderful husband who understands me so well completely. And that family support I always had with me. I'm again very blessed to have that family support, which is really a blessing, especially for women to pursue a super specialty. Is not that easy as compared to the men. Yes, I would be judgmental in this area. It's not the same as men and women. So I was really blessed to have all that help and support from my near and dear ones. Now I started my inner MBBS channel just 2 months back, 2.5 months back, on 6th December. And this was something because I have gone through a different kind of life from childhood. So my way of tackling life and looking at various events and happenings in life, so-called problems in life, was totally different. So I was like, always we can overcome it. We can overcome whatever comes. We can do it better. So doing better and tackling the situation, any situation in a different way, I think that was my attitude right from childhood, and even as an adolescent and even now. And what happened was, like now I'm a super specialist. I'm very busy. I actually have career, family, relationship, everything, money. And I was like, still, there was some 2 years back, 3 years back, still I felt that something was lacking, something was still missing. And that's when I thought, what is this missing? Everything I have, and then why am I not happy? Because I'm helping patients, I'm counseling them, I'm giving them treatment, I'm giving the chemo, targeted therapy, everything. But the same vicious cycle, and the practice was also getting nice. The number of patients were nice, doing a good job. Then why am I not happy? And why are the patients not happy? They are coming back with the same problems. This is not working, that is not working. So I thought, no, I think this much medical knowledge or whatever academic I have learned is not helping me, neither me nor my patients. Why are they coming back with the same repetitive problems? And for every problem, you just write a prescription, write a list of prescription medicines and all that. So I thought, how many medicines to prescribe? How many medicines should we take? And why I am not feeling complete. So this feeling of incompleteness led me to my personal transformation journey, wherein step by step, I don't know how it happened. I had never planned that I will step into. I have never read any books apart from medical books because actually there was no time with family, career, juggling, kids, and all that. There was no time to look up to any other book apart from the medical. I had to somehow finish my medicine, get my thesis done, and get into the practice. So there was no time to look into these so-called personality development books and all that. I was never exposed to that. But in the past 2 years, I felt that step by step, I came across various mentors, various programs, various courses. And that's when I really realized that, oh my God, whatever we study throughout our school, career, college, is actually supporting only a portion of our life. That is a job skill.
Yeah.
It's giving you a job skill. That's it. It's not giving you the much important life skill. And when real lifetime situations come in our life, uh, some scenarios will come wherein this job skill, the academics, won't help you at all. Your degree, your publications, your name, fame, money is not going to help you. You need the life skills. That's when I realized, oh my God, I really don't know about all these things. Some things were there, like determination, hard work, and perseverance, resilience, all that. But there is so much more to learn in life, and I'm still learning. It's not that I have completed every. I have just started, I should say. I'm very happy, very enjoying. And then when I did those courses, and one course I would definitely advise everyone of whoever is watching this to go and to Google and at least to know what it is and then search whoever you want to do with. It's the neuro linguistic programming, NLP. NLP, I didn't know what's NLP, and when I told Naren, he's like, "What is NLP?" So even I didn't know NLP unless and until I did it myself. I was like, "What is this?" I thought neuro linguistic programming, hoga kuch programming, it's some software or something programming, something to learn and something to pass out like an exam. But I must say, neuro linguistic programming is the way of life. It is the user instruction manual for our life. Because see, when this is our body is also like a machine. Body is a machine. It's a system. There are so many organ systems working, and not only the physical aspect, the emotional and the mental aspects of our body, the mind also is there. It's not just the physical aspect. How to use this? How does it work? And how can we, once we know how does it work, then only we can utilize it to our advantage. So, but who teaches us how does it work? As we are born, it's only our parents, our near relatives, our friends, schoolmates, teachers, and society. So these are the layers, different layers of people who support our belief and mold us. And whatever they have taught us is what we develop our user instruction manual. So the thing is, their use their beliefs and their values come from their instruction manual. So basically, we are actually replicating the society's way of thinking, believing, and living without realizing it may or may not be correct. So, so NLP actually demystifies everything. It makes it very clear, and it is like how to be in any situation and how to look to any situation. So there are many ways of doing it. Bhagavad Gita is one thing, spirituality and connection to the mind, body, and this thing. And NLP is a must for everyone. Whether you do a small course, big course, doesn't matter. Please do it. NLP really changes the way you look to the life. So my Inner MBBS channel is called as Inner MBBS, and many people told me, "How did you come across this word?" So I'm a motivational speaker also for various NGOs in Bangalore, which support the cancer survivors, because cancer survivors, our patients need much more beyond treatment. They need a lot of mental, physical, and emotional, spiritual support in their journey of cancer treatment. It's not only the medicines which are going to do the magic, they need a complete holistic support. And that's why I'm good at speaking, so I was there as a motivational speaker for many organizations, and I always stress on the importance of mind body connection, mind body spirit, mind body soul. So I thought that yes, mind body soul is important, mind body soul, mind body soul. And then I was like, oh, this sounds like MBS. So it's like MBBS. So what is the next B? And then I just came across, okay, breath. So my inner MBBS, it's actually full form is your mind, body, breath, and soul. And I am very proud to say this framework will help each and every one of us, including me. Actually, Naren, I'll tell you, this framework I developed is for me. It's for me. And I realized that how much I need is how much everyone else needs, be it my patients' families, their relatives, and the society at large. Because Inner MBBS is the framework which works on the mind, body, breath, and soul. These are the pillars of life. These are the roots of our life. Our life, if you see the logo of Inner MBBS right now, the logo is a tree with the roots and the fruits on the top. And I always say this example, my favorite example. The fruits are at the top, and everyone wants to have those juicy fruits on the trees. The fruits of life are your money, relationship, career, name, fame, job, everything we want. We want all this. Everyone wants. But what are we doing to get that? When you want good fruits, when you want more fruits, how will you get those more fruits? By working on the fruits or by working on the roots? So, if you want good fruits, you need to work on the roots. And that's the mission of Inner MBBS, that we need to strengthen the real roots of life. Aim for the root corrections of our life, the mind, body, breath, soul. If the roots are strong, if the foundation is strong, automatically everyone will get lots of juicy fruits of life. Yes, ma'am.
I really liked this full form which you explained, because I'll tell you, even as a normal person who was watching you, of course, those videos and all, I used to, I can correlate quite a lot to whatever you were speaking and all. But I also used to think like, oh my gosh, why MBBS? Like, why MBBS? Really? I was even thinking of suggesting like possibly, maybe you should think of something else. But now, when you have tried to explain me seriously, it is such a beautiful, such a soulful meaning. Mind, body, breath, soul, and with my little bit of cardiology experiences and all, I must say as well, there's such a big role. I was almost like 5 years of age when I was, I had a Diksha actually in yoga at the world's first yoga university actually. So it was called as Bihar School of Yoga, and at age of 5. So we did learn about pranayam and a lot of other things and all as well. So indeed, um, there is a big role. Yes, disease, pathology, pathophysiology, and all these things does happen. But as you rightly said, there's such a big role. I mean, I cannot emphasize it. The mind, the body, the breath, and soul, of course. And if we can take good care of all these things and all, I mean, I also believe that quite a lot of the things in our life, day-to-day life, or even diseases, like the pattern of diseases like the cancer and all, inflammation has such a big role. So I think inflammation can possibly be taken care, and not just that, even in cardiology as well. Most of these diseases like atrial fibrillation, which is something really close to me, there's a huge role for inflammation. And I think if someone can take good care of all these kind of things, one will be able to take care. And interestingly, there has been several clinical trials and all as well, where they showed things like yoga or these other things and all, meditation and all, they were able to um, maybe not treat but
Yes.
definitely retard the progression of these kind of diseases like the coronary artery disease or atrial fibrillation or any of these kind of things and all as well. That's really quite a lot insightful actually. And I must say,
Even
uh,
even
yeah.
in oncology, I would like to interrupt here. Even in oncology, we have case reports, and there are trials going on with yoga institutes collaborating with oncology hospitals, wherein they have taken cancer survivors whose blood samples were taken before starting the pranayama and yoga therapy, and to look for the T cell the quantity of T cells, immunity cells in the body. And then after a 3 months period, a 6 month period, again the blood samples were taken, and there was an objective level of increase in the amount of T cells. I mean, what else we want in our life? If our immunity is set right, half of the things will be just absolutely normal on its own. We just need to work on our immunity. And this is proven medically. I mean, medically it's proven. So we need to do it. I mean, there is no escapism.
And I must say, I think she's trying to be very extremely humble. To tell you very frankly, like I did practice even in India as well as an electrophysiologist, and I must say, in super specialty, it is very difficult, and to be able to have a successful practice, especially in such kind of corporate hospitals, it can be immensely not so easy, especially if you try to compare with the outside the other countries and all. So she's really being very humble, and as I said it, um, when you, anyone, I think, a lot of people as well, but being in their profession, one does get exposed to stress and a lot of things and all as well. And this is what I noticed, especially in the medical field or healthcare professionals. What will happen is once they start reaching the 40s and the 50s and all, I was a bit surprised in the sense that they will be developing hypertension, diabetes mellitus. I think a lot of people may agree that South Asians, especially as a race itself, unfortunately, we have one of the not just genetical predisposition for the coronary artery disease, hypertension, diabetes mellitus as well. They are literally becoming the world's capital. Even in diabetes mellitus as well, in coming few years, India is going to overtake China, in fact, as well. So what I meant is if we are not able to take care of the stress, if we don't have a little bit of soulfulness in our life, a lot of other problems also starts to happen. And one other thing, what I noticed during a lot of my traveling to literally different parts of the world, or when I was trying to speak to a lot of successful people and all as well. So, for example, in Italy, or even in US as well, or in Germany, or Netherlands and all, or France, in fact, or China as well, I traveled. I really noticed that a lot of these successful people who are really healthy people and all professionals, including the doctors and all as well, they did have had a sense of spirituality, something like a soulfulness, where they do take care of themselves as well, not just with medications, but also things which help their soul, which helps their mind, body, and all as well. So this is why I mean I can correlate to whatever Dr. Poonam has been talking in her videos and all. I would really recommend people to go through that whenever there is a possible free time. And I think a lot of insights one may be able to get it. One will be able to get a lot of understanding and all as well. It happens a lot of times. The first time or second time we may not be able to understand. And one of the problem with me is I'm a little bit overcritical. Overcritical in the sense I don't trust a lot of non-scientific people. In the sense, I'll tell you, like on YouTube, there is no doubt, or even of the our social media is filled with a lot of garbage. In the sense, one will be claiming, "Oh, drink this juice, you will lose 5 kgs in 5 days," and all. So what I mean is, and yes, take this leaf, and you will be cured of cancer in 5 weeks or something like this. So what I mean is we need to be scientific in our approach, and this is what I really liked about Dr. Poonam's videos as well. And whenever we were going through, so when she spoke about the NML, neuro linguistic programming as well, and that's a very scientific thing. And maybe we can ask her more, like because I remember from our previous conversation she had been talking about the psychoneuroimmunology, the
Yeah.
psychoneuroendocrinology as well. So perhaps maybe you can explain us a little bit more about
Yeah.
that, please.
Yes, yes. See, why I started this channel and why I really want to spread it to as many people as possible, because see, when I came across this concept of PNI, the psychoneuroimmunology concept, and it's also known as by various names, PNI or PNEI, that is psychoneuroendocrinology or psychoneuroendocrinoimmunology.
Yeah.
So it doesn't matter. It has four parameters: psychology, immunology, neurology, and endocrinology. Meaning, don't get worried about if you don't understand. If you are a common person, if you're not a medico, forget about the meaning. If there is some special concept, you remember that there is some special concept. The moral of the story is the way we think, the way we think, it alters our genetics and immunity and endocrine system. That's it. I mean, it is proven by this concept, and it has been even endorsed by the Harvard University and by various universities. It's a very well-known concept. You can Google also various data, and this concept has helped in various chronic illnesses where medicines are alone not enough. By the way, I'll come to that point that medicines alone will not help you. You need to take charge of your life, and that's the mission statement of Inner MBBS. Take charge of your life, because nobody else will take charge of your life. The doctor won't take charge of your life. Doctor will help your inner MBBS, but your inner MBBS activation is in your hands. So PNI is a concept where It is explained the way we think alters our genetics, immunity, and hormone system. Very easy example I'll give you, like how nicely Dr. Narendra told us that stress is a very common factor. Like stress is becoming normal now. If you're not stressed, then it is considered as abnormal. So that is the kind of life we are living. So let's come out of that. Stress is not normal. We are not supposed to be stressful as the evolution of humans. I mean, we were so happy in those jungles and forests and day-to-day living. Now we have accumulated so much of knowledge, so much of wealth, so much of houses, so much of everything is there in excess that we are not enjoying it anymore. So let's get out of the trap. We don't need so much to be happy. And one more mission of the Inner MBBS channel is it's for happy, healthy, holistic life. It's for happy, healthy, holistic life in that order. So it's not that healthy, happy, holistic life. It's a happy, healthy, holistic life. You need to be happy first. If you're happy, you will be automatically healthy. If you're happy and healthy, it's a holistic life. That's all. That's the area. So the PNI concept has been endorsed by many, many people and behavioral specialists and many doctors also all over the world. See the way we think, how it alters our genetics and immunity. Suppose we are just in the loop of negative thinking. And by the way, negative thinking is evolutionarily, we have been, our brain is developed accordingly. Like we have been tuned to think negative more than positive. That's how it is. So very few people will be like always positive thinkers. Most of us are negative thinkers. Anything comes, any call comes, any situation comes, we'll first get tensed and then we will change accordingly, whatever. But first, easiest thing is to become negative. So negative thinking over a period of time, the loop of negative thinking, it really increases, we know as medicals, that it increases the level of cortisol, adrenaline. And we know the immense side effects, the damage it causes at the endothelium level. The cortisol causes damage at the endothelium level and also at the genetic level to reduce the healing mechanisms in the body. So our body is designed by God in a very perfect manner. Our body is really perfect. Meaning, all the healing and repair mechanisms are within our body. I'll repeat, all the healing and repair mechanisms are within our body. We have it all. And if if the doctors who are listening will agree, if for example I'm an oncologist, if there is any abnormal cell in the cell cycle, if there is any abnormality in the cell, any genetic mutation is found which is not good and which is bad for the cell, it will be deleted. It undergoes apoptosis. It dies on its own. It is deleted from the cell cycle. It's not allowed to enter the further steps of the cell cycle. That's how we have the repair mechanisms. There are other repair mechanisms by which the whatever genetic mutations are there can be altered. But what happens when I talk that there are healing mechanisms in the body, there are repair mechanisms in the body, then why are we getting sick? Why are we having diseases? We should ask this question, no? Dr. Poonam, you are telling us that we have all the healing mechanisms. Then why we are suffering so much with disease? Because the healing mechanism and the repair mechanism is not functioning normally. Why it is not functioning normally? Because of the damage we have caused to it. And why the damage has come? Because of our bad thinking, bad behavior, bad lifestyle. So we have damaged our own healing mechanisms. Then we get diseases. Then we go to hospital and doctor and take long prescriptions of medicine. Now, tell me, when this is the circle which I explained you, if taking medicine only, how will it help you? Taking medicine will just give you symptomatic thing. Why the damage has happened? The healing has to be activated. When the healing of your body is activated again, by activating your mind, body, breath, and soul in the right direction, then the medicines will show its magic. So that's why in our practice also you would have seen, Dr. Naren, that patients who have positive attitude and who are always jolly and they're just like, oh, it's okay, I've got a heart attack, so what? I'll undergo this and I'll go back to this, I'll do this business. When they take the life in such attitude, they do really well rather than a patient who's like, oh, I've got heart attack, now what to do? I can't do this, I can't do that. So The attitudes of patients define their response to therapy. It happens in oncology as well. We see patients who are very positive, the disease doesn't relapse so fast. The patients who are always afraid, even on treatment, the disease can progress because medicines won't do the magic they are expecting the medicines to do. One very beautiful example I will give for the inner healing and how medicines are not doing the healing. Medicines are supporting the healing mechanism of the body. For example, when there is a fracture, when there is a fracture, what does the hospital, what does the doctor do when the patient goes to the emergency department? The fracture is united, just joined, placed in place, and a plaster, POP cast, plaster cast is put around, right? And after that, we wait for 6 weeks, 3 months for it to heal. Who joins the bone inside? Doctor and the medicines are not joining the bone inside. It joins automatically. And whatever vitamins, antibiotics, or supportive medicines you get the prescription, vitamin C and other, what do you say, the vitamins, these are just enhancing the inner healing. That's it. Bone gets joined on its own. That is the power of inner healing. Similarly, any wound, any disease, any infection, we have the mechanism to fight in the body. We have the antibodies, we have the T cells, fighting cells. But when that inner healing is not working properly at an optimal function, then we get diseases. So just don't depend on antibodies, just don't depend on the treatment. Make sure you do the root correction, activate your inner healing, and take the medicine. In fact, I always say when the inner healing is working at the optimum level, we won't get diseases. Even if we get diseases, because it's not like nobody can be immune. Even if we get diseases, the intensity will be less. Even if we are on treatment, the treatment response will be more. The dosage of medicines will come down. Number of medicines will come down. There are so many benefits of this framework. And also I explain it in a very, these are all there in my short videos and as well, that it's the MBBS framework, the mind, body, breath and soul. Why did I come? Like some people are only doing taking care of body. Like everyone is very fond of, even my journey started with body. I was around 71, 72 kg and I just started walking and I lost some weight and then I was feeling nice. So my journey started with taking care of body only, because once your body is like, you feel like doing more. And then I reduced a lot of weight, 6 to 7 kgs, and then I was like going on another courses, other courses. So just working on the body in terms of diet and exercise is not taking care of health. WHO also defines health as a state of complete well-being, physical, mental, emotional, spiritual, all aspects. So how can we just focus on the physical aspect and say that, oh, I'm healthy just because I'm gymming, just because I'm dieting, I'm fasting, intermittent fasting. So that is one aspect. Second aspect is mind. And mind controls all the aspects of our life. Not only the body, mind-body connection we all know now, PNI concept, but mind actually brings out the world around us. That is the power of mind. If you know the mind, this is also there in my channel videos, the layers of mind, subconscious mind, conscious mind, superconscious mind, and how they are working, and how, if we know how they are working, we can make it to work for us, for our advantage. Right now, what's happening is we don't know how they work, and so everything is working against us. And so we are stressed and we don't know how to work out the things for us. It's very easy to work out and get the things what we want. But just we should know what are the laws of universe, how does the mind work, and then we will get whatever we want. Then one more thing was breath. Now breath, if you see, how many times, all of us who are watching the video, just see how much you are breathing. Most of us are breathing only till the neck or maximum till the chest. But the lungs are way below half of the body. So lungs, we never expand completely. The smallest air sacs never get expanded. There is not enough oxygen entering. So less oxygen is entering our body because we are doing shallow breathing. We are so much stressed. We are having rapid shallow breaths. So lungs are not getting oxygenated. Enough oxygen is not required in the body. And do you know what are the two things which are required by our body? And for our life, we need only two things. oxygen and glucose.
Okay.
That's it. We don't need anything else. If we have good amount of oxygen in the body, all the metabolisms in the body will function perfect. All metabolisms in the body need oxygen. And because we are inhaling less oxygen, the metabolisms are also functioning at a low level. That's why we are accumulating all the fat around. See, how do people lose weight when they start exercising? Because when you exercise or walk fast, we are breathing fast. Our respiratory rate increases. More oxygen entering in the body during exercise helps in burning the fat cells. Yeah. So, any form of exercise or pranayama or deep breathing, if you don't understand pranayama, also is fine. Just take deep breaths whenever you remember. It will help you in weight loss, it will help your metabolisms to improve. And metabolism is nothing but like a grinding mill. So our body grinding machine. So if we set the speed of the grinding machine fast, all the fat cells will get burned fast. But the grinding machine speed depends on our metabolism, the basal metabolic rate, as well as all the metabolism. So oxygen is required. So start breathing deep, take in more oxygen. That's what we have to do. And the last was soul. Now we may be working on mind, body, breath, but what happens is we sometimes come across a void in life. Like everything is there, but still nothing is there. सब कुछ है फिर भी कुछ नहीं है. We say in Hindi. So what is that void? That void connection, void can be erased by truly understanding why are we there on this earth. When see we are doing so many things, it's like when I was in the park one day, I was seeing the children playing in the sand. They were making their own houses of sand here and there. The next day you come, everything is mixed, and again they start preparing their sand here and there. They enjoy, they go, then they come. Actually our life is like that sand garden only. We are coming, we are building our castles of whatever house, or we are job, career, name, fame. We are building, building, building. Next day we come again. Then somebody else will come, somebody else will make. So we are just making those, but sand remains. Sand remains. We are just building whatever we want to build, enjoy with that, and go away. Again we come, build something we want with that, enjoy it and go away. That sand is the soul. You mold the way you want. But remember, it is all soul. And it is the soul, like we leave this body and the soul takes another body. We all know that. So it's just like that. You play with the sand, you go. Then some other people will come, will play with the sand and go. Then some other people will play in the sand. The soul is the same. Different bodies are utilizing it. And to a larger extent, spirituality, if you see, the soul in each one of us is the same. Meaning, the sand in each one of us is the same. Just the height is different. The form is different. The way we are building the sand is different. If we have this reality, no, it's such an amazing concept. You feel that we all are one. And if you are me and me are you, how would I hurt you? I would never hurt you. How would I do something bad to you? How would I think bad of you? I mean, nobody will hurt anyone. Nobody will have that rat race competition. It's like you and me are same. We are having the same sand. I'm just building mine. You are building yours. Why can't we enjoy together? So that is a totally different. I can go on and on and it will not stop. But so why I came across this MBBS again? It is like the four tires of a car, four wheels of the car. So if we say that no, I will just do meditation or I will just do meditation and pranayam, that's enough for me. So if the four wheels of the car, if I say only two wheels are good, other two wheels are not good, it is not going to run. If three wheels are good, if one wheel is not working, it will not run. All the four wheels need to be functioning at some level. Then only the car can move. The car is the car of life. Our car, this life is like a car, and the four wheels are the mind, body, breath, and soul. The moment we realize this, we got it. 50%. The problem is we are not aware of this. We think, hey, no, no, only career, money, job, that much is like, that is my life, that's my life. But when you sit relaxedly someday, you feel that something is missing, still I'm not happy. Why I'm not happy? That's because that is only one part of the game of life. There are other parts to be fulfilled. And moment you start realizing that, you will start getting happy, because the first step to attain it is awareness that I need to work on it. And then you start taking steps. In my channel, I also break down the overwhelm, because I consider people like me, people who are watching me are people like me. So my energy, your energy attracts your tribe. It's like your vibes attracts your tribe. So if people like me are going to watch my channel, they are going to tell, I don't have time. I don't have time. As for your inner MBBS framework, I don't have time. So this is for people who say I don't have time, because I break down into very, very minute things. You don't have to do hours and hours and lot of minutes of any of the process. Just do whenever you can on the go. On the go is the mission. It should be very much doable. You can do waiting for your vehicle, or waiting for someone, or sipping a coffee. Now, meditation, people say that you have to sit with eyes closed and for 30 minutes, 15 minutes, whatever. Yeah, that is all. That is good form. But what about people who say, I don't have time? You can focus on your food when you're eating. Relish the taste. See what is going in your mouth. Taste it completely. Look at the colors of the food and eat with eyes closed. I mean, just relish that. That's the waking meditation. I mean, it has a lot of benefits. When you're having food, look at it, relish it, smell it, taste it. Activate all your five senses while having food. That's the best meditation you can do. In that way, one is meditation will happen. Second is you will become mindful. Mindfulness will come, and you will eat less because you are enjoying it more. That's how the body works. Thirdly, you will be in the now, coming in the now, present moment, being in the now. So that will happen. And fourthly, your digestive juices will be so much happy, because you are happy looking at the colors and enjoying the taste and the smell, that it will get digested very nicely and you will get all the nutrition. But the way we eat food nowadays, we are either talking, we are either working, or we are having a call and then eating. Absolutely rubbish. That kind of eating, even if you eat the richest of nutritious diet without paying attention to what you're eating, is not going to give you much benefit. It won't, your body won't get the absolute nutrition by that way of eating. So, inner MBBS is just breaking down all the things in a very, very small way, so that we don't get overwhelmed, but that we have to do a lot of things. Become aware of it and do small things. The power of small also I have explained in few videos, that why you have to do only small things. Don't do big things, because when you do big things, it only lasts for a few days and then you forget about it, because the mind rejects, because that falls in your uncomfortable zone. So make it small. When you are making it small, you are accommodating in your comfort zone. And comfort zone is what the brain loves. The brain rejects whatever goes in the uncomfortable zone. So never start big. Start small. Slowly increase your comfortable zone till it reaches the uncomfortable zone. That's the way.
No, you really summarized so well. I must say. So, for example, the power of small. I think a lot of the people will be able to understand and correlate to it as well. If you really want to achieve big as well, you must start with the small steps. You can't start jumping around all of a sudden, or even if you want to become a medical oncologist, you can't become in just a few years. It takes time, and to a lot of youngsters, whenever I meet them, especially during the medicine and all. So, for example, I did had the privilege, like last year as well, where I was working earlier. So we used to get students from Cambridge University and all. So to any of these students and all, I always say medicine is a long journey. Enjoy this journey. And unfortunately, definitely, medicine is one of the field where suicide rates are one of the highest among the any of the compared to any of the professions and all as well. And definitely. So, something like meditation and these kind of being soulful, being mindful is something which is very important. I do recall even in UK as well, National Health Service (NHS) was promoting usage of these kind of apps and all as well to help the physicians and the healthcare professionals, um, especially during the COVID 19 pandemic, because UK was one of the worstly affected countries and all. So I can understand quite a lot what you have been telling, and it really reminds me one of the lines from our beloved Professor George Cherian. So he always used to
Yeah.
say, so I do recall, I'm talking like almost 2007, 2008. So even during that time, he was almost around 20, 74, 75. So he used to say, the day we die, once we stop learning. So the learning in professions continues, especially in medicine, definitely it continues and all. And as Dr. Poonam was telling, see, everyone, we all have to also explore ourselves. And our body is nothing less than a supercomputer. The healing, it is there inside. And I think a lot of audience people, members, a lot of others and all may be able to remember the beautiful movie, what is called as Eat, Pray, Love from Julia Roberts, where she was there as well as a middle-aged lady. She had all the success and all. And I have come across several people and all as well. It happens. For I think a lot of us can correlate to that. That yes, a lot of things are there, but something is missing. Something is missing, and to make us better, to make us better, what is called as not just in physical assets, what is called as the quality of life, I would say. That is where a lot of these kind of things we need to explore. And Dr. Poonam, being a super specialist, she already said about the BMR as well, basal metabolic rate. So a lot of people we come across, they will be conscious of the weight and all. Oh, we would like to lose weight. Okay, so what is the easiest way? Indeed, using all these kind of things. Even while sitting, when you're talking, you're watching television or doing anything and all, you can lose weight if you have a good high BMR and all. So most of these diseases, severe diseases like myocardial infarction, heart attack as well, it has been statistics have shown that more than a significant number of those patients, even if they will be having a myocardial infarction, they will be having associated depression as well. And I'm sure this is practical even to cancer as well. I have come across a lot of people, if you say it to someone like cancer, so they will be already like, oh my gosh, it's like life is gone. Life is gone. And now we have so many eminent specialists like you who all understand that, and you all understand very well the NLP, neuro linguistic programming, and the psychoneuroimmunology, psychoneuroendocrinology as well, which can have a significant role, not just to be able to help people, in fact. So, this is really amazing that people like you are trying to reach out to the common people as well by sharing your expertise in such a nice way, in fact, where people can, in their free time, they can go through those videos even when they are on the move. And of course, now people can't make it as an excuse that there's shortage of time, they don't have time. So even as you were
Yes.
telling, that even being on the move as well, they can do such kind of courses as well. So Dr. Poonam Maurya, so for example, if someone would be interested in doing some courses, workshops, how to approach you or how to reach out to you?
Yes. So, yes, definitely. I have just started on 6th December. It's 2.5 months. And my future plans are to start courses. But again, after doing so many courses myself, because I was really enjoying it and I really wanted to learn a lot. But I am not sure how many people would be really investing so much of their time and money as well. How much they will have that much time, and they always people are around me saying no time, no time. So I am actually strategizing a plan wherein it should be doable, actionable courses, and I don't want to give them a lot of information because information already exists in our network on YouTube or any social media platform. If you Google, so much information is there, and people know it. It's not that we don't know it. Willing to do. Do they really want it? And even if they want it, they are like, but they're getting overwhelmed. So my thing is, again, knowledge is power. We have been writing in the schools from a small age, knowledge is power, knowledge is power, knowledge is power. But I would like to modify that statement, that knowledge on its own is not power. So the power is not in knowing, the power is in doing. So my mission of inner MBBS will be knowing to doing. How to convert your knowing to doing. What does it take neurologically or psychologically that will push you to convert your knowing to doing? You should be able to do, and very simple actionable steps to be followed. So like in our medical guidelines, we have healthcare professional version and patient version guidelines. So similarly, I'm planning to have two types of courses. One is for professionals and other is for non-professionals. So, but it will take some time because in my busy schedule, I have just started opening up on the social media platform, which itself was a big thing for me. But I'm happy that it's actually doing very well, and I wish to reach out to as many people as possible. And the announcement will be done in the YouTube itself on the social media platform. Right now, I'm reachable on my Instagram, Inner MBBS Dr. Poonam Maurya, FB also, and YouTube channel is Inner MBBS, plain Inner MBBS, no space. So regarding the courses, I would announce in the YouTube link and the YouTube channel itself.
Wow, that's really something really nice to hear. And frankly telling, I would be very much interested in joining courses like this. And as I said it, like a lot of people, it's not just about the information, but is it scientific? And frankly telling, someone like me who really tries to ask or question a lot, I would tend to prefer someone with medical qualifications, someone having a such a good background and all. So this is at least I would trust such kind of person and all who will be even able to answer the questions not just on the scientific way but also in a practical way as well. Because Albert Einstein said it: a solution is not a solution unless and until it is practical. So this is really good to hear from you that you are trying to modify it into on the move, on the go kind of things and all as well. Really great to hear for that. Any tips from you for the youngsters? A lot of young kids and all, you understand, who are there in the high school or maybe even in early stages and all. Because see, you are yourself a family person, and I'm sure you will be able to correlate how can we help those kids to be able to help ourselves, I would say. Any suggestions?
Yeah, I think inner MBBS is for everyone, and yeah, kids are more than kids. I feel even the parents should have that attitude, because we keep imposing a lot of restrictions on our children, thinking that we are parents and we are doing the right thing. Don't do this, don't do that, don't, no, 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 no. So right from childhood, when the child hears a lot of no, 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 the thing is they start building boundaries that this can't be done, this can't be done, and then slowly the limiting beliefs start cropping in. So allow them to do. I'm not telling just give a full freedom, but yes, allow them to do certain things. They are very curious. In fact, children are best to learn from. They are so open and what do you say, spontaneous and bubbling with energy and joy. Actually, I don't have any suggestion for children. Actually, we should listen to children with very warm, open ears.
Like, what are the key things one should try to keep it in one's mind in their day-to-day life?
Yeah. So yes. So I think the takeaways will be please visit my channel Inner MBBS. That's the number one point. And the key takeaways for all of us should be aware. Start being aware. You don't have to start taking any steps. Don't take notes and don't take a lot of knowledge from here and there. From today onwards, start observing your daily routine. What are you thinking when you get up? What are you thinking during your daytime? And what are you thinking at the bedtime? And when you start observing, you will see that thoughts are same. Most of them are negative. So once we are aware, then you choose to delete those thoughts, to change those thoughts, and then bring in the NLP concept where we change our filters. The way we look at things changes. So for example, every situation, any challenge, any problem is actually not a problem. The problem word itself, the definition has to be changed. The any challenge, any problem is actually your stepping stone for success. It is actually making you better resilient. Your power is showing off from that challenge. If you don't get challenges, you'll not become powerful. Simple. If you walk on a bed of roses, you will not. Your legs will be very soft. But you walk on some thorns and stones and then roses, then you will have the strong feet. It's just simple as that. So change the way we look at things. So NLP really helps in this. And let's be more mindful in what we are doing. Whenever we are mindful, whenever we are focusing, especially food, the best thing to increase focus is breath and food. Then you automatically, when you start focusing on your breath and food, your focus in other areas of your professional and family life will also improve. So it's the way we do one thing is the way we do everything. So when you start building focus on breath and food, you will see your focus has increased in all other areas of life. But what we do is we are trying to increase focus only for our career. But it doesn't happen like that. Focus. If you say focus, it won't come. You have to start. It's a muscle. It's a muscle which has to be developed. Best thing is to start focusing on breath and food and then see how it affects other areas of life. And other thing is gratitude. We want a lot of things in our life. We want a lot of things in our life, and we are just wanting more, desiring more. But whatever we have, we forget that this was also once our desire. And whatever we are having, we are not being grateful to. So when we are not grateful to what we have, we won't get more things to be grateful for. That's again the laws of universe. See.